Dr. Maya Bennett was a ghost. She moved through the gleaming antiseptic corridors of Grady Memorial Hospital in Atlanta with an unnerving quietness, a first-year surgical resident whose presence registered as little more than a whisper of scrubs against linoleum. Her dark coils were always pulled back in a severe functional bun that allowed no stray strands to escape, a testament to her rigid self-control. Her eyes, the color of warm mahogany touched with gold, rarely met anyone else's, fixed instead on charts, monitors, or the intricate landscape of human anatomy. To the attending surgeons and her fellow residents, she was competent but forgettable, just another over-caffeinated cog in the grinding machinery of saving lives. She was efficient, she was precise, and she was utterly invisible. That was how she wanted it. Invisibility was a fortress built over 3 years of painful erasure. Dr. Richard Ashford, the hospital's chief of surgery, noticed her only in the way. A general notices a single anonymous soldier in a vast army, a necessary component, but individually insignificant. He was a man carved from granite and ambition who valued precision and protocol above all else. His operating room was a kingdom, a sterile theater where he was both director and star, and he ruled it with an iron scalpel. He did not tolerate mistakes, sloppiness, or the kind of anonymity that hinted at mediocrity. Today, in Operating Room 3, his kingdom was about to face a rebellion. The patient on the table was a real estate magnate, a man whose name adorned half the new high-rises sprawling across the Atlanta skyline, undergoing a supposedly routine coronary artery bypass graft. It was a procedure Ashford had performed thousands of times, one he could complete with the mechanical grace of a master craftsman. The mood was relaxed, almost casual. The familiar rhythmic whoosh of the ventilator, a steady backbeat to the surgeon's clipped professional banter. The air smelled of iodine and cauterized tissue. Maya stood at the edge of the organized chaos, her role to observe, to retract, to be a pair of hands if called upon. She watched Ashford's movements, recognizing the economy of motion that was the hallmark of a seasoned surgeon, but also seeing the subtle signs of arrogance, a flourish here, a slightly too confident stitch there. Her mind, disciplined by a past she kept buried under layers of scar tissue, automatically critiqued every action, seeing microseconds that could be saved, angles that could be improved. It was a constant, exhausting internal monologue she fought to suppress. Then it happened. A subtle tremor in Ashford's hand as he tied off a suture, a slip so infinitesimal no one else saw it. But Maya's eyes, trained in the brutal chaos of sand-swept trauma tents, missed nothing. She saw the needle's tip graze the fragile paper-thin wall of the ascending aorta. For a single suspended heartbeat, nothing. The universe held its breath. Then a dark, welling of crimson, a single drop that blossomed with horrifying speed into a torrential pulsating bleed. The neat surgical field vanished under a horrifying tide of blood, turning the sterile drapes into a slick crimson horror. Alarms shrieked to life, their digital cries a chorus of impending doom, each beep a nail in the patient's coffin. The patient's blood pressure, displayed in stark green numbers, plummeted like a stone. 120 over 80, 90 over 60, 60 over 30. Damn it, Ashford's voice was a low growl of disbelief and fury. He and his senior fellows, men with decades of experience between them, were suddenly catastrophically paralyzed. Their hands hovered uselessly over the bloody chasm in the patient's chest. This wasn't in the textbook. This was a nightmare scenario, a once-in-a-career catastrophe that could exsanguinate a patient in minutes. Panic, cold and sharp, began to poison the air in the sterile room, a palpable, suffocating presence. While they were frozen, Maya moved. The years of forced dormancy fell away like a shed skin. The ghost became a physical presence. She didn't run, she glided forward, her steps measured and deliberate, a stark contrast to the frantic, useless energy seizing the room. Her mind was no longer a battlefield of suppressed memories, but a crystal-clear tactical map. Aortic transection, 60 seconds to circulatory collapse, 90 to brain death. Protocol is irrelevant. Hierarchy is a luxury we don't have. Her voice when it came was not the timid murmur of a resident, it was the calm, clear tone of absolute command forged in the crucible of combat. Anesthesiology, Push 2 units O-neg and start pressors. I need a 2O Proline on a V7 needle and aortic cross clamps now. She didn't look at Ashford for permission. She didn't ask. She directed. The scrub nurse, a veteran of 20 years, was jolted out of her stupor by the sheer unshakable authority in Maya's voice. Her hands, guided by instinct, slapped the requested instruments into Maya's outstretched palm. Maya bypassed protocol, tradition, and the rigid hierarchy of the operating room in a single fluid motion. She gently but firmly nudged the stunned chief of surgery aside, her touch devoid of deference. "I have it, doctor." Ashford stumbled back, a gasp of indignant rage catching in his throat. This intern, this nobody, was putting her hands on him in his OR, but his anger was smothered by a wave of shock as he watched her work. Her fingers, long and steady, moved with a dizzying, preternatural speed. She placed the cross clamps with brutal, beautiful efficiency, isolating the bleed. The torrential flow subsided to a manageable, sinister ooze. Then she began to suture, her hands a blur of focused economic motion. She wasn't just closing a wound, she was performing a high-risk aortic reconstruction, a delicate dance of needle and thread on tissue as fragile as wet paper. It was a technique Ashford had only ever read about in surgical journals, a last-ditch maneuver of legendary difficulty that he'd never even seen attempted. 45 seconds. In less than a minute, it was over. The bleeding stopped. The suture line was clean. Perfect. The angry alarms quieted one by one, replaced by the steady rhythmic beep of a stabilized heart monitor. The patient was alive. The room was utterly silent. The only sound, the soft hiss of the ventilator. The senior fellows stared, their mouths agape, their minds struggling to process what they had just witnessed. Dr. Ashford looked from the miraculously repaired aorta to the face of the first-year resident who had just saved his patient and simultaneously shattered his authority. His face was a thunderous mask of fury, confusion, and a dawning, grudging awe. He leaned in close, his voice a low, dangerous growl that was for her alone. "Who in God's name," he demanded, "are you?" His question hung in the air, unanswered. Maya simply stepped back, her expression unreadable, the fire in her eyes banking to embers. She pulled the cloak of invisibility back around her shoulders, her body slumping just enough to become a ghost once more. Ashford's hunt for an answer began and ended in his mahogany-paneled office. The skyline of Atlanta, a grid of indifferent glass and steel behind him. Dr. Maya Bennett's file was an infuriating insult to his sense of order. Morehouse School of Medicine, top of her class, stellar board scores, and then a void. A 3-year chasm between medical school graduation and the start of her residency. No fellowships, no research papers, no references from that period. It was as if she had ceased to exist for 1,000 days. He tossed the file onto his desk, the sound, a sharp crack in the quiet room. The man on his table this morning could have died. The lawsuit would have been historic. This resident, this ghost, had saved him from that, and the not knowing was more maddening than the near disaster. He called her to his office that afternoon. She stood before his desk, her posture respectful but her gaze unwavering. She looked small and unassuming against the backdrop of his power. "Your file is incomplete, Dr. Bennett," Ashford began, his tone accusatory. "There are 3 years missing." "Where were you?" Maya's internal shields went up. She could feel her pulse quicken, a cold dread creeping up her spine. "Stick to the story. Be boring, be forgettable." "I was traveling, sir. Personal matters. Personal matters don't teach you how to reconstruct a transected aorta in under a minute," Ashford shot back, his voice rising, echoing in the cavernous office. "That was not the work of a resident. That was the work of a master surgeon. I'm asking you again. Where did you learn it?" Maya's jaw tightened almost imperceptibly. The lie tasted like ash in her mouth. "I read, I study, I practice on simulations." The lie was so blatant, so utterly insufficient that it was more insulting than silence. Ashford felt a surge of anger at her defiance, at the secret she guarded so fiercely. Before he could press further, shatter her pathetic defense, his pager screamed, then another. Then the overhead speakers crackled to life. The voice of the hospital administrator strained with urgency. Mass casualty incident declared. Code triage. All surgical staff to the emergency department immediately. Maya's head snapped up, her eyes suddenly sharp, focused, and alive in a way Ashford had never seen. The polite, evasive resident vanished. In her place was something else, something harder and far more dangerous. The emergency department was a scene from Dante's Inferno. A multi-vehicle pileup on Interstate 285 during rush hour had turned the trauma bay into a maelstrom of calculated chaos. The air was thick with the metallic tang of blood, the acrid smells of vomit and fear, and the cacophony of groans, shouts, and whining machinery. Amidst the bedlam, Maya was an island of pure, cold calm. She moved through the chaos with a chilling efficiency, her mind instantly processing the battlefield before her. While others saw a flood of victims, she saw a tactical map of injuries, a hierarchy of need. Her voice cut through the noise as she triaged patients. Her diagnosis swift and unerringly accurate. This one's a tension pneumo. Get me a chest tube kit. That's a pelvic fracture. Get him to CT. He's bleeding out. GCS of 5 here. Intubate now. Tag him. Red him. Yellow. That one's black. Move on. She wasn't a resident anymore. She was a field commander directing a battle, her movements precise, her energy conserved, her emotions locked away. Ashford watched, mesmerized, as she orchestrated the flow of bodies and resources with an instinct that defied her supposed level of training. He saw her perform a rapid lateral canthotomy with just a hemostat and scissors to save a man's eyesight, a procedure most residents would never even attempt. She was a force of nature. Then the VIP arrived. Paramedics burst through the doors with a gurney, a phalanx of grim-faced state troopers clearing their path. The man on the stretcher was Georgia Congressman James Washington, a decorated and highly respected retired 4-star general. His face was a mask of blood and contusions, his tailored suit shredded and stained. Multiple blunt force trauma, possible internal bleeding, hypotensive. A paramedic yelled, rattling off vitals. Maya was on him in an instant, her hands assessing, her eyes scanning the monitors. Her focus was absolute. Let's get a fast scan. Type and cross for 6 units. He's got diminished breath sounds on the left. Let's prep for a chest tube. As she worked, her hands expertly searching for the insertion point between the ribs, the congressman's eyelids fluttered. His gaze, hazy with pain and shock, landed on her face. For a moment, there was confusion. Then his eyes widened. A flicker of impossible recognition in their depths, a spark of memory cutting through the fog of trauma. He coughed, a wet, rattling sound, and his lips formed a word. It was barely a whisper, a ghost of a sound lost in the roar of the ER, but a nearby nurse heard it, and Ashford, who had moved closer, drawn by the gravity of the situation, heard it too. "Major!" the congressman rasped, his voice choked with blood. "Major Bennett, what are you doing here?" The name hung in the air like a live grenade. "Major, not doctor. Major!" The nurse's eyes widened. She looked at Maya, then back at the congressman. The rumor began to ripple outwards, a shockwave of disbelief through the frantic ER staff. The quiet resident, the ghost, a major. Ashford felt a jolt as if he touched a live wire. Major Bennett. The name echoed in the chambers of his mind. The missing 3 years, the impossible surgical skill, the command presence in a crisis. The pieces didn't just click into place, they slammed together with the force of a bomb blast. He was looking at her, but his mind was a world away. The sterile white of the ER replaced by the dust and sun of a war zone he could only imagine. His brain constructed the scene with stunning clarity. The dust and heat of Baghdad, the percussive thud of mortars shaking the very air, the screams of the wounded in a makeshift field hospital, the air thick with the smell of copper and cordite. He saw a younger Maya, her face streaked with grime and sweat, her eyes burning with a ferocious intensity as she fought to save a life on her operating table. A direct order crackles over a radio. "Fall back. Evacuate now. The position is being overrun." And he saw her shake her head, her voice raw as she yelled back over the din of battle, "Negative. I'm not leaving him." He saw the court-martial that followed, the cold, sterile courtroom. The charges, insubordination, conduct unbecoming an officer. She'd saved the wounded ranger, but her defiance, her refusal to abandon a single soldier, had delayed her unit's withdrawal. costing them a high-value target. She wasn't dishonorably discharged, but her career was executed just as surely. Her name, once whispered with reverence in military medical circles, was now a black mark, a cautionary tale. She had been forced to bury Major Bennett and become a ghost, starting from the very bottom, hiding in plain sight. Ashford snapped back to the present. The ER was still chaos, but for him, there was only one point of focus. Maya. He saw the flicker of sheer panic in her eyes, the instinct to retreat, to vanish again as her carefully constructed fortress crumbled, but there was no time. A tech rushed towards them, a tablet in his hand, his face pale. Dr. Ashford, Congressman Washington's scan. He has a transected subclavian artery and a massive retroperitoneal hematoma. He's bleeding out internally. He needs an OR right now. Ashford's blood ran cold. It was a complex, lethal combination of injuries requiring a vascular trauma specialist of the highest order. His top surgeon, Dr. Chen, was trapped in another critical case from the pileup, the second. Best was out of state at a conference. There was no one else. No one with the skill, the experience, the nerve, no one except the disgraced major standing right in front of him. What would you do? Trust the chain of command, the paper credentials, and let a man die? Or trust the evidence of your own eyes? The ghost who performed miracles. Every surgeon in the ER was looking at him, waiting for his decision. The entire hospital, it seemed, held its breath. Maya looked at him, and for the first time, he saw past the resident's facade. He saw the warrior she had been, the surgeon she still was. There was no fear in her eyes, only readiness. He found her a few minutes later in a small, cramped supply closet, her back to the door as she wiped the congressman's blood from her scrubs with a sterile cloth. Her hands were perfectly steady. The air smelled of alcohol swabs and latex. Ashford didn't waste time with pleasantries. "Ore is being prepped," he said, his voice flat, betraying none of the turmoil inside him. "It's yours, lead surgeon." Maya slowly turned to face him. Her expression was a careful neutral mask, but her eyes searched his, questioning the impossible. "Sir, my privileges are irrelevant," Ashford cut her off. "You are the most qualified surgeon in this hospital to handle that injury. I don't give a damn about your past or what some general's name is on your discharge papers. I care about the man dying on my table. So are you going to stand here, or are you going to go save his life?" For a moment she didn't move. Then, a slow, deliberate nod. The ghost was gone. Major Bennett was back. The doors to operating room 3 swung open and she walked in. The energy in the room shifted instantly. The circulating nurses, the anesthesiologist, the assisting residents, they all looked at her, the whispered rumors of the ER fresh in their minds. They saw the first-year resident, but they felt the presence of a commander. "Status," Maya said, her voice ringing with an authority that left no room for doubt. The chief resident, a man who had barely given her the time of day for 6 months, now answered her like a private reporting to his sergeant. "Patient is unstable. BP is 80/40 and dropping. We're barely keeping up with the blood loss." "All right," Maya said, her eyes scanning the bank of monitors, absorbing every piece of data. The familiar weight of the moment settled on her, not as a burden, but as a mantle she was born to wear. "Let's get started. I want a cell saver ready, and I want 10 units of FFP and 10 of platelets in the room. I'll need a giggly saw and a full vascular tray. Let's move." The surgery was a controlled storm. Congressman Washington was bleeding from a dozen different places, his body a roadmap of trauma. Maya was the calm at the center of it all. Her hands, which had been invisible just hours before, were now the focal point of the entire room. They moved with a purpose and intelligence that was breathtaking to witness. She performed a median sternotomy, cracking the chest with the giggly saw to get immediate access to the shredded subclavian artery. Her commands were terse, precise: suction, Metz, DeBakey clamp. The team around her, initially hesitant, was now a seamless extension of her will. The chief resident, who had once viewed her with condescension, now watched her hands with a look of pure reverence. They anticipated her needs, their movements fluid, their trust absolute. She was not just repairing the damage, she was fighting a war on multiple fronts, managing the patient's coagulopathy, directing the anesthesiologist, and improvising solutions to complications that would have stumped a lesser surgeon. At one point, as she repaired the artery, the patient's heart fibrillated, the steady beep dissolving into a chaotic squeal. The team flinched. "Internal paddles," Maya said, her voice perfectly level. "Charged to 20. She placed the paddles directly on the heart, delivered the shock, and the rhythm returned. She didn't even pause. More suction. The retroperitoneal bleed was the final challenge, a deep hidden enemy. Maya navigated the treacherous territory of the abdomen with the confidence of someone who had done this 100 times before in conditions far worse than this. She located the source, a torn lumbar artery, and with a few deft, perfectly placed sutures, she silenced it. Hours passed. The frantic energy gave way to a state of intense, sustained focus. Finally, Maya placed the last stitch. She stepped back from the table, her sterile gown spattered with the blood of the man she had just pulled back from the brink. "Close him up," she said, her voice quiet but filled with the weight of exhaustion and triumph. She stripped off her gloves and walked out of the OR without a backward glance. Dawn was breaking over Atlanta, painting the sky in bruised shades of purple and orange. Maya stood at a large window at the end of a quiet corridor, watching the city awaken, the adrenaline slowly draining from her, leaving a profound weariness in its place. She felt a presence beside her and turned to see Dr. Ashford. He wasn't looking at the skyline, he was looking at her. The arrogance and dismissal were gone, replaced by a deep, unwavering respect. "The congressman is stable," he said. "He's going to make a full recovery. He's already been on the phone with the Pentagon. Seems a 4-star general carries more weight than a court-martial conviction. He called it a gross miscarriage of military justice. He's making it his personal mission to see your record cleared." He paused, then turned to face her fully. "What you did in there, that was artistry. I've never seen anything like it. I misjudged you, Dr. Bennett, profoundly." Maya simply nodded, too tired for words. The apology was unexpected. The validation, a strange foreign feeling. "This hospital needs a surgeon like you," Ashford continued, his voice firm. "Not as a resident, as an attending. Head of trauma surgery. The position is yours if you want it. It was more than a job offer. It was an apology. It was recognition. It was a chance to finally stop running, to stop being a ghost in her own life." Maya looked at her reflection in the glass. For the first time in 3 years, she didn't see a phantom haunted by the past. She saw a surgeon. She saw Major Maya Bennett. And she was finally home. "I accept," she said, her voice steady. A new day was beginning, not just for the city of Atlanta, but for her. The past was not erased, but it no longer defined her. Her future was here in the controlled chaos of saving lives. Her skills not a secret to be hidden, but a gift to be used. The ghost of OR3 was gone for good. If you enjoy this story, make sure to subscribe for more.